think I said it's my first day for about 2 months. Anytime anyone came over, I go, so sorry, it's my first day.
Hello, welcome to the Coffee on Call Medicine podcast, a podcast series to help ease your transition from medical school to foundation. So sit back, put away the textbooks, and grab a coffee. Enjoy.
Hello, and welcome back to Coffee on Call, the Foundation Medicine podcast. My name's Kitty, and I've got Amy here with us.
Hello.
And Polly.
Hi.
And today we are going to have a chat about rotations and what it feels like to get more responsibility. So, firstly, the big one, 5th year to FY1. How did it feel then? How does it feel now, looking back on it?
So I think I had, hopefully, a fairly unique experience that won't happen again to people who are moving from 5th year to foundation. So I unfortunately graduated in 2020. So I had all of my finals cancelled. And then I was thrust into the world of being an interim F1 in May, and then started my real job in August. So I had a little bit of an unusual experience, and I think it was very stressful, a very unusual time. And I think particularly because I didn't sit any finals, I had a huge amount of sort of like self-doubt and like, you know, the classic imposter syndrome when I started. So it was a really, really big transition for me, and I think probably the biggest, hopefully, I will have, just with sort of how everything was. So yeah, it was quite a challenging time. I found it quite stressful. But equally, I got to spend a lot of time sort of doing basically an extended shadowing period with my interim bit, which was really helpful when I then started my proper foundation job in August.
And was your interim in the sort of specialty that you were then going to start in, or were you specifically deployed for COVID? How did that work?
Yeah, it was absolutely just madness, to be honest with you. Every shift we showed up, we were allocated to a different place. I was on an emergency rota, so we were working like 2 days, 2 twilights, 2 nights, 2 off, 2 days, 2 twilights, 2 nights. So I was working on surgery, oncology, COVID CPAP wards, Gen Med, AMU. So it's proper induction by fire to starting work, but it did make actual starting work a little bit easier.
I was going to say, what I'm hearing from a tips to students and F1s is actually the more time you spend on the wards and the more time you spend being in F1 or a junior doctor in a supported environment, the better.
Oh, it was amazing. So I think because I had that pressure of I'm actually getting paid, and like not to talk about how I was as a medical student, but when I was a 5th year, I probably had started to take the pressure off myself a little bit. It was sort of like, I'm nearly a doctor now. We can, just to relax a little bit more on placement. And actually, when I was like, I've got responsibility here, it meant that I was doing all the cannulas that I would maybe have tried to avoid when I was in final year placements, or, I was having to think about prescribing and looking at all that kind of stuff, writing TTOs and stuff. Being able to do that with an F1 as your shadow, who's just behind you, who can then pick up when you're struggling and can't do it, kind of made me realise that actually doing that in a sort of slightly different way at the end of 5th year would have been a lot more helpful and made the transition a bit easier.
Okay, yeah. So yeah, take note. Just
yeah.
And try not to qualify in a pandemic.
Yeah,
is that achievable?
My general advice, is don't qualify during a global pandemic. But
How about you, Amy? Was yours marginally more normal?
Yeah, mine was a little less exciting, I have to say. But I was still terrified. I think as everyone is. I think if you say you're not scared, you're lying. Well, I moved cities, so I believe both Polly and Kitty, you sort of stayed where I trained. Whereas I trained elsewhere and then moved. So for me, it was obviously a new job, a new role, but it was a whole new place. So I didn't know anyone. I think there were a handful of people from my medical school who happened to pick the same place or sort of be allocated, as it were. But I didn't know anyone, and I was living by myself, and it was quite challenging because obviously you don't have as an accessible support group. You kind of have to make your new one. But my first job was surgery, which was brilliant for that because there's loads of F1s who are all in the same boat, and it was a very sociable job.
Okay.
And you ride the highs and the lows together, and there's a lot of funny moments. So
I thought you were about to say there's a lot of lows.
well, but and those doctors, you know, Varun being one of them, are still sort of my core friendship group from work. And now we're all SHOs together. So I think it can be a really bonding experience.
Yeah. Okay. And if you were to start on a medical job, moving cities, do you think the same would still stand? It's just finding friends in a new city, finding other F1s.
Most trusts have some version of like a mess, so a kind of junior doctors committee that organise meetups. You know, you might go to the pub, you might sort of do X, Y, and Z in the city. And that's a really good way to discover the city that you've moved to and meet other like-minded people. But you know, there's lots of allied health professionals that I'm also friends with. You kind of meet through work, so. Yeah, I think just sort of putting yourself out there and attending these things, even if you're tired, is what I'd recommend.
And I think when you're new somewhere, it's almost the best thing to do is to own it and arrive on a ward and say you're new, say you've never worked in the hospital, and then people will guide you and help you, won't they?
Absolutely. I think I said it's my first day for about 2 months. Anytime anyone came over, I go, so sorry, it's my first day.
And then you can do exactly the same thing when you move wards every 4 months.
Exactly.
So how did you guys find rotating as an F1?
I think I found rotating as a foundation doctor both like sometimes really enjoyable, sometimes really frustrating. So I think one of the beautiful things about the foundation program is if you're in a specialty you're not super sure is for you, or maybe you don't 100% like where you work, you're only there for 4 months and you get to start fresh somewhere else, and you get this huge amount of experience that's really helpful. So on my surgical job, I just had a medical job, so when maybe one of the consultant surgeons wasn't sure what to do with like someone who'd just gone into AF or something like that, I could be like, oh well, I remember from my medical job I've got all this new experience and I know how the pathways work and I know who we can speak to. And you get to meet loads of new people, you get to work with loads of new people, which I found really enjoyable. I think some of the things that can be challenging, and I found this a lot more in my F2. So my F1 was all in a very small DGH where even though I was moving wards, I was 20 metres up the corridor than I had been from the previous 4 months. My F2, I worked quite specialist jobs that were in even different hospitals. I had a psychiatry job that was in its own hospital, a paediatrics job that was in its own wing of the hospital, and A&E that's a completely isolated department. So each time it came to that 4 months, not only was I sort of having to learn a new group of people, which is often quite fun to do, it was a whole new set of systems, a whole new set of acronyms, a whole new set of referral processes. And that can be a little bit taxing.
Whole new set of logins.
Yes, new logins. I had 3 different sets of logins over the course of the year. And that I found a little bit taxing sometimes. Just it takes you about a month to settle into a job, and then 2 months to find your feet, and then the last month when you suddenly know what you're doing, you're transitioning to move off again.
Yeah, you do get a huge amount of experience rotating around different specialities though, and I think it's really helpful when it comes to deciding what you want to do when you're grown up. If you rattle through specialities as a foundation year rather than a foundation year 2, it gives you a bit more experience and helps you decision making.
Yeah, I'd probably echo that as well. I mean, already in my current job, I'm drawing on experience from previous jobs and saying, I've done, for example, a hepatology job. So actually, we wouldn't drain this, or, we would do X. And what's nice is you meet all these colleagues that you work with. And then when you're in a different specialty and you have to ring them up, to have that familiar voice on the end of the phone is really nice to say, oh, hiya, how are you doing? Oh, so you're the registrar now? Yeah. Can I talk to you about this?
Yeah.
And it's that kind of community of medicine that's really nice.
Yeah. Definitely. And I think by the time you've worked in either a small hospital or a bigger hospital, actually when you've been there for a couple of years rotating around departments, actually those hospitals come to feel pretty small. So make use of rotating around those specialities, make friends, and own your first day for 2 months.
As long as it suits.
And how did you find the step from F1 to F2, or in fairness, the step from 5th year to foundation year, getting that extra responsibility?
So I think I didn't really experience the SHO step until my last job of F2, and then definitely now I've started IMT. So I'm an internal medicine trainee, which means I'm training now as a specialist within hospital medicine. And I think that was because I think in your F2 you can sometimes get some odd jobs. So I had a paediatrics job, which I was treated exactly the same as the F1s, and I was pretty much on their same rota. I had a psychiatry job, which was just so bizarre in its own world that it was so unique. And and then I had A&E. And then when I was in A&E was the moment where I felt that transition to, I'm making decisions now, and I'm making those discharge decisions. And then going back to being a ward sort of SHO, I know it's an old-fashioned term now, but being that ward SHO, this is the first time I've really had F1s and F2s now as well, sort of looking to me for answers. And it's a big shift. And I think you can look back on where you were a couple of years ago, and actually it's really hard to recognise how far you've progressed until you sort of circle back to the same environment, but with that experience suddenly realise that you actually do know the answer to the questions. You actually can, do that difficult cannula that the F1 can't get and stuff like that. I think it's actually given me a lot of self-confidence and a lot of like looking at sort of progression, being able to come back and then kind of that shift.
Yeah. So we've talked a little bit about foundation year 1s and foundation year 2s and IMTs and SHOs. So we've covered this a little bit in another podcast. But for those who don't know, after you finish medical school, you start your foundation years and you rotate around 6 different specialities over 2 years. For the first year, you're foundation year 1, and for the second year, you're foundation year 2. And then after that, you have the option of applying to further training. So Polly, you've said that you are an internal medicine trainee,
yes.
So a couple of years of internal medicine training, and then you can apply to your specialty training. Yes. And that's what I've done. So I went down the IMT route, and now I'm an oncology registrar, so doing my specialty training. Whereas Imi, you're thinking of going down a different route and potentially going down A&E training, which you would start after F2.
Yeah, so I'm a current foundation year 2, which is sort of interchangeably used with SHO. I mean, I think for me, I did feel quite a big step up because I went from a big teaching hospital to now being in a DGH, a district general hospital, which are generally smaller. So generally, there's less staff, so you're looking after more patients. And certainly being a medical SHO at the moment, I cover a wide variety of specialties on call. And now I have F1s who look to me for help, and I have registrars who I look to for help. And, you've got sort of that senior escalation process. But I think what you don't realise is sort of as the foundation year 1, because you're finding your feet, as it were, you've got a lot more safety net, and you've got a lot more, it felt to me at least, less expectation. So if you did something good, that was excellent, and you did something not so good, that was okay, and someone will swoop in and rescue you. Whereas as the SHO, good is kind of the expectation, and you need to rescue other people. So I find, I'm a much better doctor for it, and I've got a lot more experience with unwell patients and kind of having to be the leader. But that was quite a big step up for me. And I don't think I expected it to feel like such a big change. But I certainly sort of wrestled with my imposter syndrome for the first few weeks.
I was about to say, you've both brought up imposter syndrome. Tell me a little bit more about that. What does imposter syndrome mean to you?
I think to me, it's sort of a sensation of just sort of being sat there and having to pretend like you know what's going on, and just the back of your mind just sort of screaming at you that you have absolutely no idea and you're a fake and someone's going to find you out. And I think it's really normal with transitions into different jobs of actually going, I don't know. And I think one of the ways that you can own it is by sort of just talking to people about, oh my God, I don't know to do here, like, they told me to refer to this specialty and I've got no idea what the process is here, and can you just help me out? And we've all been there, and everyone's always really helpful and happy to do it. But I think imposter syndrome, I think particularly types of personalities that people who go into medicine tend to be quite perfectionist, wanting to be on it from day one, and it's just impossible when you change roles so frequently.
I think you've highlighted 2 bits to me there. The first is everyone has imposter syndrome. Yeah. And I think you're absolutely right. And the second thing is actually it's all right to, to not know. And actually as a medic, you have to know your limitations and know what you don't know and know who and when to ask for help.
And I think I completely agree. It's taking ownership and taking that power back. So, I was covering quite early on in starting being an SHO, I was covering cardiology, and I've never done that before. And I sort of said to my registrar, I sort of swallowed my pride, swallowed my worry, as it were. And I said, I've never done this before, so I might ask you a few more questions, but I'm just finding my feet and I'm new to the hospital. And she was really lovely and understanding, and she was saying, you know, I'm new to the hospital as well, we'll work it out together, don't worry. So I think just acknowledging that is really powerful. And I certainly try and encourage the F1s to do that as well. You know, no one's going to be angry with you for asking for help. It's okay.
Yeah, I was about to say that. Speaking as a slightly more senior than as an F2, I would much rather know if my junior doesn't know what to do. Because actually, even as a registrar, if I don't know what to do, I've got a bit more experience to be able to come up with a plan, which I wouldn't expect a more junior doctor to do.
I mean, did you feel the step from sort of middle grade to registrar, sort of higher grade, was that a big jump for you?
Yeah, I think it's really hard, and particularly as when you've been on the wards as an internal medicine trainee for a few years, you know where you're at, you know what's going on the wards, you know where the sick people are, you know which patients are coming and when, and then suddenly you're a registrar and actually you've got outpatient clinics to deal with, and then you're also on call, and people want specialty advice when you were the IMT trainee yesterday. But again, you know, it just comes back to owning that imposter syndrome. Everyone feels it and know when to ask for help, because people want to help, and there is always someone around to help, whether it be midnight or midday.
Should we chat about the box? Or?
Let's chat about the box. Do either of you have a tip for medical students, junior doctors, about how to get the most out of rotating?
I think mine would be extra kind to yourself whenever you're in these transition periods. So, you know, my support network, my family, my loved ones, they know, unfortunately, what times of year I'm rotating. And I normally give them a heads up and say, hey, I'm changing job next week. And they know, you know, I might need a bit more support. I'm going to need more sleep. I need to make sure I eat because it's really stressful. And, you know, you might be going to a whole new building, a whole new hospital. As we said, IT, logins, you know, all those things actually really tire you out and you don't realise. So just be patient with yourself and don't fill up that time too much. I wouldn't say let's get married at the same time as changing job, for example.
How about you, Polly?
I definitely echo that, and book your annual leave. That's the one I'd put on that as well.
Yes.
To make sure you book all your annual leave so you've got something to look forward to. I think even if you absolutely know from day one what you want to do, and you think, why on earth am I sat on a psychiatry rotation? I'm going to be an orthopaedic surgeon. You can take something out of every specialty that you work in. And even if that's just, I really liked how the psych regs communicated with patients, or I really liked how fast the surgical reg was on ward rounds and how efficient they were with decision making. And even if it's not the knowledge of that specialty, even if it's just some of the skills that come with the people who've developed within that specialty, you can take something out of every job. And so go into every job with thinking that you're going to get something out of it. And then even if it's not a specialty for you, you'll end up enjoying your 4 months because you'll take something away from it.
Yeah, I like those too. I think mine would be a little bit similar to yours, but rather than be kind to yourself, be kind to people around you. Make friends with people around you, help people around you. You know, the nursing staff, the physios, the ACPs, because they've all got something to teach you, and they're all there to help you, and they're all there to look after the patient. So actually, if you're kind to those around you, particularly when you move wards, departments, specialities, they will help you. Yeah. And ultimately it will help the patient. Cool. Thank you very much, guys. Thank you.
See you
later.